Thyroid treatment success secret number 10, thyroid binding globulin. When thyroid hormones are secreted from your thyroid gland, they are bound to a carrier, a protein. This protein is called thyroxine binding globulin, or TBG. So TBG is similar to a taxi cab, and your thyroid hormones T4 and T3 get into the cab and they're transported to the liver where they're converted. And when they jump back into the cab and they're transported to the rest of the body, you have this little carrier going anywhere and everywhere inside your body. The fact is that there are so many of these little taxi cabs or carrier proteins called TBG that the normal free amount of T4 and T3 that should be floating around isn't. It's as if they'll all get sucked up by this big sponge, by all these little taxi cabs, which are thyroid binding globulins. Here's the thing. Your TSH will look normal. Your total T4 will look normal. Your total T3 will look normal. If that's all the markers your doctor's checking, then the problem's completely missed. This is why you need to do all the thyroid testing done, not just TSH, T3, and T4. You need TSH, resin T3 uptake, free thyroxine index, reverse T3, and the thyroid antibodies, in addition to the TBG, thyroid binding globulin, free T3, free T4, and total T4. If your TBG is too high, even though your TSH is normal, and T4 looks normal, and total 3 looks normal, and your doctor needs to check your T3 uptake, it will show that actually the T3 uptake is low when the thyroid binding globulin or TBGs are high. Remember that the lab reference range of T3 uptake is extremely broad, where the optimal or functional range is much narrower. Estrogens, a hormone hanging out in the body, elevates TBG also. Birth control pills contain estrogens. Some face creams and cosmetics contain undisclosed estrogens, and these estrogens can elevate in your body and they're detoxified through the liver. If you have poor liver function or inability to detoxify, this is yet another reason you can still have thyroid-type symptoms. It's not necessarily a thyroid gland problem, but it's more of a liver problem. It is important to realize that there are many more causes of your thyroid function, more than just my TSH is low. Again, we want to do all the testing and get to the root cause of what's happening with the patient. At thyroid binding globulin, TBG, you could have low thyroid symptoms, but normal lab numbers even though you're taking medications. Don't suffer another minute. Call our office at 336-229-4226 and schedule 2 free visits with Dr. Naylor. Call now. Space is limited.